I live in Spain, and today is the 8th day that we've been on mandated lockdown. So,
hmm
could you just give us a description of what the current situation is in Ecuador?
Well, this is the fifth day that we're on mandated lockdown too. The only thing that can be open in the streets is supermarkets and pharmacies, and they have a strict laws for what plates can go out which days and so what time. And I think that the laws are gonna be getting stricter and stricter because cases are growing very fast in Ecuador. Like yesterday, we only had 199. Today, we have 347 cases of
Mm-hmm.
coronavirus. And most of the cases are in my city, pretty much, or my province.
Mm-hmm.
Um, so that one of the things that we had to do on Monday before the actual lockdown, we try to do home services.
Okay.
So I know the difficulty of the staff of like taking buses or taking taxis. So I just contract one person, and between one person and my car, which are like take the staff to the different houses around the city. So to make sure
Mm-hmm.
everyone will get services and then pick them up and bring to the center. Obviously, the parents were worried because they don't know the background of the therapists, who they were contact, or so a lot of parents have started canceling services mostly for to prevent the coronavirus. So Monday afternoon, I had to take the decision of closing the center, all the centers, because we have three centers. And we were
Yeah.
actually going to open now in the first week of April. We had to open one center in a more rural place where we have a waiting list of kids to receive services. So that news was disappointed for the parents, for the staff. They're worried about their jobs, and the parents are
Yeah.
worried about the progress of their kids. And
Mm-hmm.
obviously, I'm the mom of everyone, so I'm worried about everyone, the staff and the kids.
Mm-hmm. That must have been a really hard decision.
Yes, yes, because it was either doing home services, but I knew at some point the government was gonna dictate to close everything, and literally that happened that same night that we decided to close services.
Mm-hmm. So you were already thinking proactively of how you can
Yeah,
continue to support the families.
yeah. So at that Tuesday morning, we were in a meeting with my uh, coordinators. We have three coordinators in each city, and we were talking about, okay, so how can we help, because parents will be texting me, and they're, it was just Tuesday before the lockdown, and parents were texting already at 11 a.m. and say, my kid is already stimming and he stopped doing that. And you know how parents are, they get worried and they're like, that's because of the services. How am I going to do now? And, I don't know what to do with my children. And I have to take care of my other daughter, and then also my child with autism. So in that meeting with my coordinators, we decided to try online supervision. We say, well, the parents have watched the therapy
Mm-hmm.
at least twice a month, and they go to monthly meetings for reports. They go to all the workshops. So now they're gonna have to do it.
Mm-hmm.
So we texted the parents to see who wanted to do it, and I was very surprised because I didn't know a lot of people wanted it. I was very surprised that pretty much 60% of our parents wanted to do the online services.
Mm-hmm.
Okay, and why not the other 40? Because the other 40 is pretty much bigger kids that have really good skills, playing skills, speech skills. So parents only needed like a routine, and that's it. But the little ones is the other 60%. Um, so all parents say yes. So we
Mm-hmm.
started doing schedules, and we started that 3 days ago. And the first day was hard because the kids are not getting used to the parents telling them what to do, and the parents get nervous. But yesterday and today, we even had to put new objectives on the kids program because they were mastering things.
Wow.
And who is the best motivator and than anything else than parents? I mean,
Mm-hmm. Yeah.
there's no comparison.
They just want their parents' attention.
Yeah, they just want the parents' attention, their tickles and their songs, and especially the little ones. And we were very surprised. Like today, the last meetings were today, this morning, and we were very surprised. Like kids for the first time was manding like car and chocolate, and the parents like, he's never done that. And like, well, maybe because and I was trying to explain them. And we only do it for 1 hour for each kid because I have to do all the kids for now, and until I assign it to the coordinators to do it on their own. And right now they're only taking data on manding for the little ones.
Okay.
Yes.
Okay.
So that's how we're trying to like keep up the supervision. So if one day I meet with the kids from Guayaquil, then the next day I meet with the kids from another city that's called Manta. But the kids from Guayaquil, the parents have to do still services on that day that I'm not meeting, and they have to send us small videos of them doing the session.
You've been watching Autism Knows No Borders. If you like this video, please give it a thumbs up and subscribe to our channel. Also, we'd love to hear from you, so let us know what you think in the comments section. Click here to watch this interview in its entirety. You can also find us on your favorite podcast app. Tune in each week for engaging conversations of how people across the globe are inspiring change and building community. Thanks for watching. Take care.